Assalamu alaikum, yakan abdu yakan astain. Welcome to my channel Dr. Shami says. So in today's video I'm going to go through the surgery 22nd May morning paper. So question number 1, in injury to the brachial plexus there is a loss of flexion at elbow due to the damage of the musculocutaneous nerve. The patient presented with the complaint of numbness of index finger and there is a loss of sensation of the index and the middle finger due to the damage of median nerve. The patient did hyperextension of the lower limb and now in semi-flexed position due to the involvement of anterior cruciate ligament. The sprained ankle resulting from the excessive eversion most likely demonstrate which structures damage, that is a deltoid ligament. Question number 5, the injury to thigh, what will be the damage at the apex of the femoral triangle, that is the profunda femoris artery. The promoter germ cells are derived from the epiblast. The left gastric vein drains into the portal vein. The eventration of diaphragm occurs due to the improper function of the lateral muscular wall with the pleuroperitoneal membrane. The husband wife want to conceive. What will counsel them about the chances of pregnancy at the time of luteinizing hormone surge? The patient is sitting with the both arms abducted, line drawn between tip of the scapula correspond to which vertebra, that is the T7. Om at the time of the ovulation is in the skin side during inspiration, which decreases, that is the negative pleural pressure. The left ventricle LBB RBB is supplied by the LCA left coronary artery. The IVC blocked up to azygous vein. Dilation will be in the right ascending lumbar and the right subcostal vein. Next, during surgery, patient was given anesthesia with 5 mg thiopental. Soon after induction, patient BP drops and the tachycardia. The mechanism behind this is the anaphylaxis in the last trimester of pregnancy, what change the respiratory parameters occur. There is a decreased carbon dioxide. TLCs, white blood cells travels between the endothelial cells and exit via the blood vessels through a process known as the diabetes. The 4-year-old girl with a history of bleeding in family and the CBC, HB 13.5, TLC 6, and platelets 85. Next, investigations shows macrocytes. The diagnosis would be definitely ITP. Lateral attachment of urogenital diaphragm is the inferior ramus of the pubis and the shield tuberosity. 20. Which hormone maintain the ECF osmolarity, that is the vasopressin. Next, the right shift of the oxygen dissociation curve is caused by the decreased pH. Despite acidosis occurs in the drowning. Patient presented with the case of diabetic nephropathy. Diagnostic test for the diabetic nephropathy would be the microalbuminuria. Next, for Lia is the feature of the cerebellum. Next, the patient presented with the dizziness and the vertigo after history of fall. On CT scan, the subdural hemorrhage is suspected. But of the falling vessel is involved, that is the cerebral veins. Patient the right sided hemiplegia, left sided pain, and the temporal temperature lost below T8, while right side proprioception and the touch sensations lost below T8. What is the cause? That is the hemisection at the T8. GVE of the vagus nerve is the dorsal motor nucleus. Next is the type of neuron present in the spinal sensory ganglion is the pseudo unipolar. 29, which of the following muscle of the mastication help in the deep inspiration during the yawing and increase carbon monoxide. There is a lateral pterygoid. The patient got firearm injury to the lower limb and developed foot drop. There is a loss of dorsiflexion due to the damage at neck of fibula. Which of the following organism causes meningitis in the age of 5 years? There is a streptococcus pneumonia. The neuroendocrine hormone in the stress is cortisol. 60-year-old lady presented with the fracture of hip bone. Which supplement might be the beneficial for the lady? There is the egocalciferol. Which of the following substances must be further digested before it can be absorbed by the specific carriers in the intestinal cells, that is the sucrose. Next, the patient presents the single solitary nodule. Now, investigation oval nuclei seen. It is the papillary CA thyroid. The blood transfusion reaction occurs when the A is transferred to the B. Next, the dead space increases in the hypertension. 50-year-old man presented with the HB 8.2 in large spleen, TLC raised, PFS may showing the immature myeloid lineage, which is the genetic defect. There is 9:22. Next, the low-grade follicular lymphoma translocation is V, there is a 14:18. Histology slide shows the drop-shaped ratty ridges, nuclear hyperchromatism, nuclear polymorphism, loss of polarity, and ASF invasion by the malignant epithelial cells. The most likely diagnosis is the Richter's carcinoma. 25-year-old girl presented with the lower abdominal pain. She is suspected of having abdominal pelvic mass up to umbilicus. Chest metastasis is also found. Which tumor marker is used for the follow-up of this patient? That is the CA125. The child with osteomyelitis. Which is the correct regarding osteomyelitis? The most common cause by the Staph aureus. Next, during hiatal hernia repair, there is a damage to the nerve affecting intestine. Which part will be spot? That is sigmoid colon. Patient can the emergency to center water. JVP 2 liter cardiac output 2 liter cardiac output, 2 centimeter water is the JVP, lactose 30 in the blood, BP is 70/30, which is the shock is this, that is the hypovolemic shock. Actinomycosis, jar draining abscess, the falling, that is the granuloma with abscess, which comes from the Weichselin duct, that is the Michel's diverticulum. Maximum of beta cells and islets of Langerhans are present in the tail of the pancreas. The person got a stab wound 3 cm vertical on the lateral right side of the linea alba. Initially he was fine, but then developed hypertension and shock. Which vessel is most likely damaged? There is the IVC. The female patient undergo radiotherapy of the axilla due to the mets of the breast carcinoma. Now she is more prone to develop angiosarcoma. In trace of JVP, the wave produced by the right ventricular contraction is the C wave. The patient fell on outside hand and there is a fracture of the distal end of the radius. It is moved ventrally in the lateral. This fracture is called the Galeazzi's fracture. Next, the ventricle filling is represented by the TP segment. The superior laryngeal artery and the internal laryngeal nerve passes between the thyroid and the hyoid. The length of left bronchus is 5 cm. The phrenic nerve avulsion at its origin will lead to hemidiaphragm paralysis. The mirocolic is the branch of the superior mesenteric artery. The ureter damage during the hysterectomy at the base of the broad ligament. The alkalization of the urine is helpful in the toxicity of the phenobarbital. Luteinizing hormone 2 days before the ovulation is 6 to 10 fold rise, which intestinal movement helps to mix chyme with the food or chyme with the food, whatever you may pronounce. That is the myometric reflux. After hypophyseectomy, which cells will be affected? The follicular cells of thyroid. The factor in both intrinsic and extrinsic pathway activation is the factor number 8. The patient developed anemia after gastrectomy. What should be given to him? The intrinsic factor, the patient after artery having urge incontinence, which region of the spinal cord is damaged? The above sacral. Next, child X-ray showing the unilateral hydronephrosis. What is the cause behind this? That is the pelvic ureteric junction obstruction. Glucose absorbed in the kidney is by the secondary active transport. Regarding active action potential in the nerve fibers is the terminated by the efflux of potassium. Kid with the thick secretion having sweat chloride test positive. His parents are normal. The mode of inheritance would be the autosomal recessive. The plaque is caused by the deficiency of the niacin. The bony landmark of the parental nerve block is the ischial spine. The Byers block uses which? Mostly that is the prilogen. Anesthesia given in epidural block goes to the dorsal horn. A newborn baby is born to a 20 years old prima gravida. On examination, the baby has amputated limb. The most likely cause would be the amniotic bands. Major blood supply of the perineum is from the internal potential artery. Patient presenting the shock-like condition of artery. Multiple soft tissue injury cause of shock in this condition would be the peripheral vasodilation. Hypokalemia is caused by diuretic, that is a spinal electron. How much time a bolus takes to reach the colon? That is 8 hours. The patient has the renal plasma flow of Higgs under SAT 0.50. Calculate the blood flow to the kidney, that is the 1000 ml per minute. Retromandibular vein is formed by the junction of the superficial temporal and the maxillary vein. The sensory preganglionic sympathetic fibers are the white tremors. Peripheral neuritis is caused due to the deficiency of the vitamin B1. The cell arrest in the diplotin phase of the prophase. For carbohydrate metabolism, which vitamin is necessary? That is the thiamine. Next, 84. The young boy having mass in the neck. Biopsy of the lymph node shows aphesis architecture. A typical mononucleosis cells with the bilobed nucleus and the eosinophilia. And the CD15 and the CD30 positive diagnosis is the Hodgkin's lymphoma. The monitoring of the extrinsic pathway is related to the warfarin. The patient having the vesicular rash in the palm soles with the blistering lesions on the tongue and gums, which is the following is true about virus causing the disease. That is the naked positive sense RNA. Baby has rash in the slab cheeks caused by the virus having structure that is single-stranded negative DNA virus. Next, 88. The 22-year-old prima gravida has noted no fetal movement at 18 weeks gestation. Fetal ultrasound examination shows the marked hydrops fetalis and organomegaly. There is extensive cerebral necrosis in the periventricular calcification infection with the following organism most likely to produce these findings. The cytomegalovirus. A lady had pet in a house and had exposure. Which organism likely to cause symptom in this lady? There is a toxoplasmosis. Tests which detect and rule out the disease is the sensitivity. Next, which fiber sensation will be lost first after administration of local anesthetic agent? That is C fibers. A 9 years old boy admitted for the surgery, complaint of dry mouth. Examination shows the white patches in the mouth, difficult to eat and swallow. What should be treatment option? That is a miconazole. The patient has the hypoxia at the high altitude. It will be detected by the peripheral chemoreceptors. The patient undergoing the thyroidectomy developed the hoarseness of voice and respiratory difficulty due to the damage of recurrent nerve. During menstruations in the postration, which layer is shared? That is a functionalis. Which of the following is the neurosecretory hormone? That is the oxytocin. The next is the thoracic duct block causes the chylopericardium. 60 years old, non-diabetic for the last 20 years, present with rapidly progressive renal failure. Most likely cause is the Kimmel-Wilson syndrome. The patient with unable to move eye to lateral side and having contralateral hemorrhages due to the ligand of the pons. Patient with a complaint of the regurgitation chest pain and midnight partially relieved by the elevation of the bed head side. Frothy like liquid is coming from the mouth. What should doctor advise? That is the decrease fatty diet. Nerve supply of the rectus abdominis is the lower 6 thoracic. Next, the nystagmus is due to the lesion of the flocconodular lobe. Hepatorenal ligament contains the following structure, that is the portal vein. The secretory hormones from the neurohypophysis are stored in the nerve endings, cause the hypotension. In the cardiogenic shock is the decreased myocardial contractility. Damage to the upper part of the shoulder. The artery that is bleeding is a branch of which artery? That is the axillary artery. Next, 107. The sternocostal surface of the heart is formed by the right ventricle. In HIV patient, surgery done, then which antiseptic to use after surgery to clean floors and the walls? That is 1% hypochlorite. Which of the following is the microhydrophilic organism? That is the Campylobacter. After RT-GFR decrease in the patients came the excessive bleeding. Cause of the decreased GFR would be the decreased arterial blood flow. Next, the most aggressive tumor is basically the melanoma, with the exception of the sweat glands, parasympathetic parasympathetic system. Cause what? That is the promote secretion. Student has Viva exam. What waves are seen on EEG? That is the beta waves. The male presented to OPD with a 104 fever for the last 4 days. He has history of using antimalarials. He has been passing cola urine for the last 1 day with derange LFTs and increased unconjugated bilirubin. What is the cause? That is the glucose 6 phosphate dehydrogenase deficiency. Sexually active person develops oropharyngeal carcinoma, most likely virus related is the HPV. Next, 116. The metastatic breast cancer sentinel lymph node biopsy helps in saving the axilla during the pregnancy. In the malignancy of breast nipple, earliest lymph node to drain is the axillary. Next, the patient sustained injury in the RTA, then presented with the gait problem. The examination, he was asked to stand on his right neck. While doing so, his left pelvis sinks. The following is the most likely damage, that is the right gluteus medius and the minimus. Next, 119. The while walking muscle, that supports the opposite leg to the straight is the gluteus medius. The structure inside the cervical fascia is the common carotid artery. Patient present the RTA, plantar flexion lost. Foot is in the dorsiflex position. Nerve damage would be the tibial. The biological activity of the immunoglobulin is due to the FC portion. Student examining standing, which shows gram positive cocci in the chain. Many attempts made but cannot be cultured. What other techniques can be used apart from this? That is the serology. 10 years young boy presented with the fever, headache, vomiting. He is having neck stiffness and altered mental status with hallucinations. Which among the following? The brain eating, then dignity of Larry. The child with the multiple fractures, blue secret family history, that is defect in the collagen. Next, the post adrenalectomy patient died due to the deficiency of the aldosterone. Right, suprarenal vein drains into which of the following IVC? Which the following is correct regarding the glucagones? Next, this is the gluconeogenesis in the liver. Next, the cardiac muscle cannot be tetanized due to the long refractory period. The tumor suppressor gene involved in the renal and the gonadal agenesis, the WT1. Lady suffering from the CA breast undergo the total mastectomy, developed edema of the right upper limb. Which of the following can be the reason of the edema? That is the lymphatic obstruction. Ligament parts to read the epidural space is the ligamentum flavum. Newly born child having the ossification center. Which of the following? Distal end of the femur. Sulfur granules contain what? That is the actinomycetes. The person with the difficulty in the swelling, there was some white growth inside esophagus. The pseudomembrane, likely reason is the candidiasis. The skin retest for the aspergillus is the galactoman. Next, 18-year-old male is brought to the hospital in inhaled sensorium. He is taking slow shallow breaths and his breath has a fruity smell. ABGs are this is due to the DKA, diabetic ketoacidosis. Femur is mediated by the interleukin 1. Next, regarding pseudostratified epithelium, all cells reach the basement membrane. Next, 140. Which of the following is correct regarding the percentage of B and T lymphocytes? That is T lymphocytes 80 to 90%. beta lymphocyte 10 to 20%. The pro-erythrocyte has basophils due to the polyribosomes. Auto regulation of the kidney is by the tubular glomerular feedback mechanism. Earlier sign of the reversible cell injury is the hydrophic changes. Next, which of the following is the pan mediator, that is the bradykinin. Next, the carcinomas are usually very lethal and incurable. Which of the following is the curable carcinoma? The gastric adenocarcinoma. Bifurcation of trachea at the carina is at which vertebral level? That is the T4, T5. The girl did suicide with a gunshot, which fractured and caused the TDO and hemorrhage. Artery damage is the branch of the maxillary artery. A male with a long-standing history of the hypertension diet. On autopsy, his heart was found to be 600 gram. Reason of the increase in the heart size is the hypertrophy vessels, while the damage arterial layer from the inner to the outside damage will be that is tunica intima, media, and the interstitia. Next, the newborn after 6 hours of hematomatous swelling over the parietal bone. What is the common site for such swelling? That is between skull and the periosteum. Normal distribution curve is the median equals mean equals mod. Mechanism of the cancer formation is the initiator followed by the promoter causing carcinoma. The girl presented the non-resting tumors, lesion present in the cerebellum. The patient presented in ER with the GCS of 12/15. The part of brain affected will be the temporal lobe. Epstein-Barr virus can be best detected by the activated T lymphocytes, which ulcer is caused by the infection by the microelophilic non-hemolytic streptococci and the aerobic hemolytic streptococci. That is the Milanese ulcer. Down syndrome is most likely due to the overexpression of the gene. Side effects of the dicumarole is delayed clotting. The patient has a history of memory loss with the following disease associated with this disease, that is Down syndrome. Next, the patient presented with the easy bruising, hemolytic anemia. This occurs due to the deficiency of which vitamin? That is the ascorbic acid. Boy continuously failing in exam. He is doing anger to his parents. This type of the defense response is the displacement one. Geikie disease enzyme deficiency is the glucosylphosphatase. The massive blood transfusion leads to the hyperkalemia, decrease NH4. For placing CVB, which muscle is used? That is the sternocleidomastoid. During suprapubic catheterization, at transfers incision is given. Which of the following is the most likely damage? That is the inferior epigastric artery. The patient has the chronic of to mark him as the patient of chronic bronchitis, which finding should be present. The hyperplasia of the mucus gland. Upper lobe consolidation is related to the TB. Two vertebral arteries join to form basilar artery. This is called the convergent. Next, the tubular structure with absorptive surface area and the numerous lymphoid tissue is appendix. Women with the iodine deficiency causes the poor dietary status. Next, the hyperkalemia associated with the flaccid paralysis. Which of the following is true about the plasma proteins? Exert an oncotic pressure of 25 mm Hg. MI occur to the thrombosis. Which factor is important and independent of other factors? That is a prolonged immobilization. Which part of intestine thick loop with less mesentery fat and the long vasa recta with her arcade? Surgeon asked by uplifting of gut during the surgery, that is the jejunum. Patient presented with the heat intolerance, weight loss, and anxiety. Test to be done for the diagnosis with the TSH3 T4. SL was on the microscopic examination. Large amorphous mitochondrial densities are found, indicating irreversible cell injury. 14-year-old boy came from Balochistan. The painful legs, ulcers in the legs, jaundice, and the Howell Jolly bodies. The diagnosis would be the sickle cell anemia. The cause of preterm labor is the bacteria vaginosis. The anesthetic agent decreasing hepatic blood flow would be the halothane. Athletes having large heart size comparatively and increase stroke volume. Instead, their muscles need same amount of energy and having cardiac output approximately same as that in the normal individual. What can be the reason for this phenomena? That is a decreased heart rate and increased SV. Opsonization is done by the FC portion of IgG and C3b. Next, the clot retraction occurs due to which of the following? There is the platelets. Which part of the intestine does intima histolytica reside in? That is the cecum. 18 years old girl present with the history of amenorrhea, otherwise normal appearance and secondary sexual characteristics, ultrasound absent, ovaries and uterus. What is the cause? It is the androgen insensitivity syndrome. Which antihypertensive drug is given to asthmatic and ID patient during the surgery? That is the IV nitroglycerin. The young pregnant lady with a history of recurrent abortions and thrombosis. The most common autoimmune disease associated with the abortion would be the antiphospholipid syndrome. The 8 years old boy used to eat mud, vomited, and has respiratory symptoms. Paused to 6-inch long worm to his nose. What is the organism? That is Escherichia. So that's all from this video. Thanks for watching my video. Do subscribe my channel. Until my next video. Allah.